We're taking this, 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 we're taking with a pinch of salt.
Dear colleagues, I'm Dr. George Kosmadakis, a nephrologist and the host of today's podcast, A Pinch of Salt. In this podcast, we decided to discuss on a subject that people acknowledge that it is good for the patients, but do not know how to assimilate it, how to introduce it, and are not fully aware of the arguments to use in order to convince the patients to do it. I'm talking about physical activity in patients with chronic kidney disease, and I couldn't find any better person to discuss about it than Alice Smith, Professor of Lifestyle Medicine from the University of Leicester, UK. Professor Smith is a renowned leader on research in physical activity for patients with chronic kidney disease. Alice, it is an honor and a pleasure to have you with us today.
Thank you, George. No, it's great to talk about this. This is a subject that's very close to my heart and I've been working on for many years. So yeah, thank you for the invitation.
Well, I'm sure it would be a very interesting discussion. Well, it sounds crazy to try to convince people that moving their body is good for their health. But eventually, we have to find some good arguments in the minutes to come. So I think there are plenty of things to discuss, and I will get to the first question directly. And this is why should patients with kidney failure would have a physical activity?
Okay, so physical activity and exercise is just fundamental to the health and well-being of everyone. And kidney patients are surely no different from that. And indeed, exercise capacity and measures of physical fitness, such as walking speed, are the best indicators of longevity there are for the human population. So kidney patients are no different to anybody else in that respect. But for some specific reasons, I mean, we know our kidney patients are at extremely high risk of cardiovascular events and poor outcomes. They have many comorbidities, particularly diabetes is particularly common. Their blood pressure is a particularly important thing for them to manage. They also tend to suffer from lots of symptoms such as extreme fatigue, which impacts on their quality of life and their mental health. And they also often find themselves suffering from muscle weakness and wasting, which contributes to the fatigue. And this is partly due to the direct effects of uremia on the muscle, but also because they're a very inactive population. They tend to be extremely sedentary, and then they enter into a cycle of downward spiral of inactivity and deconditioning, which just gets worse and worse and worse, and their physical function is very poor. And this just drags them down, and they're missing out on the many benefits they could get from being more active, from being physically active. So there is increasing research evidence out there showing myriad benefits for kidney patients of being more active, of doing some exercise. There was recently in the UK, we published our first guidelines on national clinical exercise guidelines on what kidney patients at all stages of the condition should do. And you can read about that. It was published in BMC Nephrology in 2022, and is a really in-depth review of the literature on the subject. But we can make this too scientific and complicated. Really, our patients really just need to get out there, become more active. We need to support them and help them to do that. And the benefits are massive and very varied. So different people benefit in different ways. And this is one of the reasons why it's really hard to do good exercise trials and generate really robust, high quality research evidence. But everybody stands to benefit. And as well as clinical outcomes and longevity and avoiding really catastrophically bad clinical scenarios, we also need to consider just the benefits of maintaining physical function for everybody, which helps people to stay working, do meaningful activities that matter a lot to them. to avoid becoming dependent on their family and or the society to look after them. And therefore, you know, there are not only benefits for the health services, but also for society to reducing the burden and financial implications of that. And most of all, perhaps, what the patients often value more than clinical outcomes is their quality of life, their ability to participate in meaningful activities that really matter to them and that they enjoy, things like social life, their families, their hobbies. And this is what being active can really help them to do. So not only to live a longer life and avoid bad clinical outcomes, but also to live a better life and enjoy the life they have despite their kidney disease. So those are just some of the reasons why we really should be getting people to be more active and to do their exercise.
Yeah, that answer, you know, as well the question why patients should be interested in this, and you actually pointed a very important issue concerning quality of life, and we are in the era of prems and proms, and we have started passing the attention from the medical needs to the patient needs, which is I don't think it's a bad idea. And physical exercise, I think, is a perfect tool for this change of paradigm in the treatment of these patients. So I will pass to another question that a lot of people are asking because they're afraid. Which patients should exercise and which patients should not exercise?
Okay, so there are a few patients who will have absolute contraindications to exercise, and that's got to be a clinical decision on an individual basis. So, you know, we can't give an all or nothing answer to that question. The person's own clinician needs to make that decision. But the vast majority of people can be more active than they are. We're not talking about everybody needing to run 10K or lift massive weights or do anything like that. For most people, this will be a matter of just getting out of a chair and doing a bit more than they do now. And therefore, nearly everybody can do that. And it's just a matter of them doing what is the right thing for that individual.
Everybody according to their needs and to the aim that we have
absolutely.
for every.
And the really important thing here is that those who are the least inactive and the most functionally incapable stand to benefit the most, because even a small increase in activity for those people will actually be a big percentage increase, and they are the ones that stand to gain the most. So even people who just can't even get up out of a chair can still be more active. So we need to broaden our idea about what exercise is, and it's not necessarily putting on a pair of trainers and running 10K or going to the gym 3 times a week. You know,
sometimes the aim is to go to the supermarket or do some errands
or just break up sedentary time. You know, don't sit there for hours on end. Just get up every half hour and move around a bit. And so it means a different thing for every individual. So I think, you know, apart from just a very few people who have really complicated medical problems, most people can be more active and should be, and will gain a lot from doing so.
Yeah, that's an excellent message to all the colleagues who are very reticent to include patients in these programs, because, you know, actually the cardiologists were much faster than us, and they have started these rehabilitation programs with patients with very severe cardiac diseases much earlier than the nephrology community.
And we can learn from that, because those patients, you know, you'd think it would be dangerous, but actually they benefit. It's just about doing the right thing.
Doing the right thing. It's it's logical to ask you another question. What sort of exercise should they do, and how much of it? What kind of what do we mean with this?
So this is going to be different from each person. So you can get scientific about this, and we can say, you know, there are 2 main types of exercise. So there's cardiovascular aerobic exercise, which is good for the heart, and that is any kind of activity which raises the heart rate a bit, gets people breathing a bit more, feeling warm, and is sustained for at least 10 minutes every session. And that's your aerobic exercise. And, you know, general guidelines across most countries nowadays suggest that people should be doing 150 minutes a week of moderate exercise. That's broken up over several days, or 75 minutes of very vigorous aerobic exercise. And then there's the other kind of main exercise, which is strength training, resistance training to build muscles. And that's really important, especially for kidney patients who will find their muscles become weak and waste, but can still build muscle. And obviously you need to do both, because without good muscles, you can't do your aerobic exercise, but the muscles are really important for function, for stability, for not falling over, for dexterity and stamina. And they also have massive physiological and metabolic effects as well. So muscle is really important. And most guidelines recommend people do at least 2 sessions of strength training a week, working the major muscle groups in the body. So those are the 2 kinds of exercise, and our kidney patients certainly should be aiming to do that. However, this is all sounding very complicated and ambitious, and we can just simplify it down to what the individual wants to achieve, what they enjoy, what they can feasibly do within the constraints of their health, their surroundings, their opportunities, their financial aspects. So basically, the best exercise regime for a person is one that they will do and keep doing. And that might be only quite a minor increase in what they're doing at the time, but they need to keep doing it. So you need to develop this exercise regimes in partnership with the individual who's going to do them, and make sure it's something that they'll enjoy, they are going to be able to do, and that they'll keep doing. So basically, although those guidelines of 150 minutes a week plus 2 strength training sessions are ideal, in fact, anything more than they're doing now is good.
Of course, even 1 minute more, is a benefit.
1 minute. So within reason, the more the better, but even a small amount is better than none at all. So getting people moving in any way that they will do is really what we're aiming for.
How can I explain to a patient what is a medium intensity and a vigorous exercise? How can he feel? How can he feel this?
Yeah. So when we're talking about aerobic type exercise, so walking or running or cycling or swimming, so basically they need to feel that their heart is working a little bit harder, that they're just slightly out of breath, and perhaps if they keep doing it, they'll start feeling a bit warm and sweaty. But a good way of thinking about it is that you should still be able to talk in full sentences to someone who's doing it with you. You shouldn't be gasping for breath, but it's not as easy as if you and I are just sitting here chatting like this together.
It's not.
So it's somewhere in between those.
Right.
Yeah.
Right. Okay. Yeah.
And they've got to keep that going for at least 10 minutes at a time.
Yeah, and increase every session progressively.
Yeah. So, and once they're comfortable, just be noticing that if they're now chatting away like we are, they're not doing it hard enough. They need to push a little bit harder, and that happens every so often. But yeah, but it's not supposed to be gasping out of breath, feeling terrible.
Right? Yeah. Because that might. They might be afraid.
And exactly. They shouldn't. And quite. So as long as you can kind of exchange a brief conversation with someone while you're exercising, you're not pushing it too hard.
Yeah. Now I will get to the 1 million pounds question.
Yeah.
How do you get people to do it? Well, and a small comment on this weight loss issue.
Yeah. Okay. So there's 2 questions there, George. So let me just start with motivation.
Yeah.
So the person has to identify their goals. They have to tell you what they want to achieve. So it's having a conversation about perhaps something they used to enjoy doing that they can no longer do, or they're finding more difficult, something that's really meaningful and important to them. And that will be different for every single person, what they value, what they find important in life. And if we can help them to see that by being a bit fitter and a bit more active, they will be able to start doing that thing again or carry on doing it. Now they're finding it too hard. And that might be, like you said earlier, walking to the shops or playing with the grandchildren. And, you know, it's basically about helping the person to identify what's meaningful to them, that makes their life worth living, that they need to keep going, to keep doing, and that being more active will help them do it more easily. And then setting realistic and achievable small goals to begin with that they will achieve, because there's nothing more motivating than setting a goal and achieving it and going, yes, I did it. And monitoring and recording is really important, because it's very encouraging and it shows them the value of what they're doing. So how we do that is it depends on what the goal is and what the person will do, but they need to notice their improvements. And often psychological improvements will come before physiological improvements, so they will find themselves feeling better in themselves in some way, and it's really important to get them to notice that and record it and feel a sense of achievement from having achieved it, even if it's only a really small thing. And that leads us on, doesn't it, to this whole business of weight loss. And so many people think that the reason to exercise is to lose weight, and if they're not overweight, they don't need to exercise, which is completely wrong, because there are so many other benefits to exercise. But one thing it is not easy to do is lose weight entirely from an exercise regime. And certainly not from one that's going to be relatively modest, like the ones that our kidney patients are likely to achieve. So the whole thing is steer people away from the expectation that they're going to see appreciable weight loss in a short time, because they're not. And if they set themselves weight loss goals, fail to achieve it, they will just give up and become demoralized.
Of course.
So weight loss is, you know, there's lots of reasons to lose weight. There's other ways, you know, the best way is a dietary one, and this just needs to be separated from exercise, because exercise has many myriad wonderful benefits, but weight loss is not one of them.
So motivation is important.
Yeah.
And we shouldn't give the wrong motivation.
Yeah, absolutely. Yeah, and don't set them off on an unachievable goal or unrealistic expectations. So, you know, again, I'm going to run 10K in a month is not achievable for most people. So don't do that. Talk about, you know, climbing the stairs, walking to the shop, noticing how easier that becomes with a bit more effort, and just that kind of thing.
Yeah. So we start probably with the functionality, independence in the daily activities of life.
Yeah.
And afterwards we start talking about more sporting event.
For some people, you know, and some people are already quite active and they can be more ambitious with their goals. But those people aren't really the ones. They're the ones that are already motivated. The ones we need to help are the ones that just sit there and do nothing.
Yeah.
They're the ones that need to be encouraged to get up out of a chair every half hour. They need to just try walking a little bit further each week than they do already. And then noticing themselves being able to do that and congratulating themselves from it. And another thing really to do is to include other people, so friends and family, because exercise is good for everyone. And when you're not feeling quite in the mood to go out and do whatever your program is for today, if you've got someone else who's doing it with you, they'll go, come on, we'll go and do it. We can get this done. And that's just sometimes the thing you need to get up and do it. So if possible, include other people, get an exercise buddy, and you'll be doing them good as well.
Other people, you mean members of the family?
Yeah, members of the family, or, you know, sometimes it's a community exercise group.
Community exercise.
You know, or it's different for different people, isn't it? And everybody's situation is different. So, but just finding other people to exercise with is really motivating and helpful for a lot of people.
And sometimes we see that the first ones who are engaged in this are those who don't really need, because it's the patients who are the most active. But we could probably use them as champions, probably.
Yeah, absolutely. And you know, patient stories are really, really powerful and encourage one another. So if we can find a patient champion who's done it before, who's noticed some really good gains and is a real believer in it. You know, sometimes those stories are really motivating for other patients, and moral and peer support is really encouraging just to get people started. Yeah.
Yeah. Well, and we get now to the $2 million question is because we have the patients, we have the patient champions, and but sometimes the biggest resistance is coming from medical or paramedical staff concerning this engagement in the physical activity projects. Do you have any pieces of advice for somebody who would like to?
That's always a difficult one, isn't it? Because many healthcare professionals really either think that their patients can't or won't and don't try, or maybe they have their own resistance to being active themselves. I think it is a hard one. It's about changing the culture within a unit, but that's easier said than done, obviously. I think finding someone within the unit who really does believe in it and is full of enthusiasm and passion to take everyone else with them is useful. But I think, again, as we were just saying about the patient stories, so I know why do I do this? Why have I been working in this field so long? And the same with you, George. I mean, we started out together, didn't we, in 2006, running a small exercise trial in Leicester, and we found some really good physiological and clinical benefits from that. But the things that really stayed with me, and have probably stayed with you too over the years, is the patient stories, what the patients told us they gained. And I remember one chap in particular who used to have a favourite walk that he'd go on along the seafront on holiday, and for a few years he hadn't been able to do that, and his wife had gone off to do the walk by herself, and then after doing our exercise program for a while he was able to do that again. And I remember him telling us that with tears in his eyes about how happy that had made him. And just stories like that are so powerful. I think, we need to make the most of those. And when somebody tells you one of those stories, capture it, relate it to the other staff, because that's what we're here for, isn't it? To help our patients live a better life. And that kind of thing is really powerful. So I think staff should hear those stories and listen to the patients and listen to what benefits they get. And, if someone isn't convinced by something like that, well, I'm sorry, are they in the right profession if they're not moved by some of the fantastic patient stories that we have?
Of course. And, we all have some stories to say, and this takes part in our personal professional history as well. So let's hope that we'll sensitize people on this. And
another thing, George, is some people don't know what to. They're worried about telling their patients to exercise. They don't know what to recommend for them to do, and so I can recommend the Global Renal Exercise Group website. If you can just search for that, has an actual training program on it for healthcare professionals about how to encourage patients to exercise and what kind of exercise they should be doing. So sometimes knowledge builds confidence in staff. So that's something to recommend as well. And on that website as well, there are resources for patients. So I can really recommend that anybody interested goes to look at that Global Renal Exercise Network. Yeah.
So, dear colleagues, have you heard it? If you are really interested, you can have a look at the Global Renal Exercise Network. There's a website and plenty of information. Don't be afraid. So it was wonderful. Alice, now I will get personal, and I'll ask you a typical question we ask or our invited guests. And the question is, if you were in a desert island, which is the book, luxury item, and 2 songs you would take with you?
Okay, so you told me you were going to ask me this, so I did do a bit of thinking about it. So if I was on a desert island, I'm sorry, but I'm a scientist, and I would end up being really interested in the fauna and flora that was around me and want to learn a lot about it. So I think the book I would take might be the Gerald Durrell Corfu trilogy, because that is a wonderful book, including My Family and Other Animals, where he is in fact not on a desert island, he's on Corfu, but he just shows such passion and interest in the minutiae of the fauna and flora around him and tells wonderful stories. So that, I think that would inspire me to do the same. And my luxury would be my painting and drawing box, so that I could record those animals and plants and in very scientific detail. And I think that would really keep me occupied. And also, I just love painting and drawing, and it would be actually nice to have the time to do that. So those are those two things. So songs are really hard, aren't they? Because,
of course.
So you know that my husband is a wonderful musician, an amazing guitarist, and you know, actually my favorite music is whatever he's playing, and I'm still as starstruck by him as I was when I first met him 30 years ago. But I think what you're asking is something more well known. So we take the songs with us from our youth, don't we? So for me, that's things like Blondie, The Police, Dire Straits. So I'd probably have a Blondie song, something like Sunday Girl. And then when I was at university, we used to love a song called Come On Eileen by Dexys Midnight Runners, and that always reminds me of those happy days at university. So those are probably my two songs.
Wonderful. Well, I like them as well.
Good.
Well, now, we know that you come from Leicester, UK,
Yeah.
but people know about London or, some other towns. Probably have heard about Leicester City, the football team, but they don't know about the town of Leicester.
Okay.
Can you just tell us a couple of sentences about Leicester?
Yeah, so Leicester's a really amazing city, actually, because it's so diverse, culturally diverse. So more than half the population are from ethnic minorities, particularly the South Asian population. And that makes such a fantastic, wonderful, vibrant city with amazing food. So yeah, that's a reason to come to Leicester. It's a great city from that point of view. We have Richard III, who's a medieval king from England who died in a battle not far from Leicester, but his body, because he was the loser, his body was never properly buried and was lost. But a few years ago, he was actually dug up in a car park in Leicester, and the remains were identified as him. It's a fascinating story, and he's now reburied properly in Leicester Cathedral. So that's something that's really interesting about Leicester. And the third thing I'd like to say about Leicester is that it has the John Walls Renal Unit, which is one of the biggest and most research active kidney units in the whole of England. And this is John Walls Renal Unit's 50th year since it was launched in 1974. So we're proud of it. It's one of the first in the country, and we're going to have a big party later on in the year to celebrate that. So yeah, that's Leicester.
Great, great. So there is a king who's a park warden for a few centuries there. So that's amazing. So thank you so much, Alice, for being with us today. I hope that some people who had doubts are a little bit more convinced and encouraged to get on with exercise, an exercise program. And I wish you an excellent afternoon. Here it's snowing, actually.
Okay, so it's pretty cold here, but it's not snowing.
Yeah.
It's sunny.
So thank you so much, Alice.
All right, nice to see you, George. Take care.
Bye. Thank you.
Bye.
Thank you.